Good morning. Welcome to the Cuyahoga County Human Resources Appointments and Equity Committee. Madam Clerk, please call the roll.
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Turner,
Here.
Mr. Gallagher,
Here.
Mr. Miller,
Here.
Ms. Conwell,
Present.
Mr. Sweeney.
Present.
You have a quorum.
Thank you. Is there any public comment?
No, Madam Chair, no one has signed in.
All right. Can I have a motion to approve the minutes from the July 11th meeting?
I'll make such a motion. And I'll second it.
Okay, good. Moved by Miller, seconded by Sweeney. All in favor?
Aye.
All righty. Madam Clerk, would you read the first item?
Resolution 2023-0208, confirming the county executive's appointments and reappointments of various individuals to serve on the Cuyahoga Regional HIV Health Services Planning Council for various terms. For the appointment of Anthony Thomas, Daytona Harris, Elizabeth Aquiriano, and the reappointment of Leander Lovett. And at this time, we're going to take the appointees out of order, starting with Elizabeth Aquiriano.
Good morning, Councilwoman.
Good morning.
Zoe Toscas, on behalf of the County Executive and pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the appointment of Elizabeth Aguirreano to the Cuyahoga Regional HIV Health Services Planning Council to a 3-year term that starts on August 1st, 2023, and will end July 31st, 2026. We're requesting a second reading suspension. Zachary LeVar is here on behalf of the Cuyahoga County Board of Health if there are any questions about the board, but I think Elizabeth will go first.
Okay, Ms. Aguirreano, did I say that right?
Joining us via Zoom.
Hi, can you all hear me?
We can, thank you. Good morning.
Awesome. Good morning, everybody. Thank you for having me. I appreciate this.
All right, what would you like to share with us?
Well, I appreciate the opportunity and hope that I'm able to serve the board efficiently. I've been sitting in on meetings with the Community Liaison Committee for 2 years, actually, waiting for this appointee. So I'm pretty excited to finally get here. So I appreciate all the efforts that were made to get me here. Just wanted to let the board know that I'm from Ashtabula County. I live in Ashtabula, was born here. 3 out of 4 of my children were born here. I've been a nurse in the community for the last almost 18 years, working 11 years at the local hospital, ACMC. I have been living with this disease since 2013. And there's just such a lack of resources in this area. And I'd really like to be a bridge to help bring that into the fold and to be an advocate for the folks, not only from folks living with, but also medical staff, folks that don't realize that there are resources in the community. It has been a struggle, not only to keep a caseworker from month to month just to get meds, and to have resources to reach out to. And I see a need and I'd like to fill it.
Well, we appreciate that. Are there any questions from my colleagues?
Madam Chair, is your microphone on?
Yeah. Oh, is that better? Okay, sorry. Councilwoman Conwell?
Through the chair to Elizabeth, because I'm not going to try your last name. I might mess it up.
No worries.
Just wanted to know about when you stated the lack of resources. Is that more so just for the Ashtabula area? And is it with the drugs, the actual physical drugs itself? Could you touch a little bit on what those resources exactly are?
Definitely. Well, so when I was diagnosed, it was in April of 2013, and I was assigned a case manager. At that point, a case manager, the person was assigned to us, didn't even reach out to us until August of that year. And being faced with a terminal diagnosis is frightening, and it's a crisis that I saw the ball drop there. And then just month to month, in the 10 years that I've been living with this, I have had 10 caseworkers. So it's a struggle to keep consistent staffing. This is a diagnosis not everybody wants to share with everybody, and to have to retrain somebody every year, it's a burden on the local facility that takes care of that, which is Signature Health. We're now in training, like I said, with our 10th caseworker in 10 years. All the local pharmacists know me not only because I worked at the hospital and called in a bazillion prescriptions for our patients, but because I've had to fight just to get med availability for myself, to keep myself safe, and to reach out for resources is, and for me, it becomes a struggle because this is Cuyahoga County thing. And so folks don't think Ashtabula County. And even though we are part of this whole dynamic together, we're really the folks sitting on the outside. And like I said, I've been sitting in on the meetings for community liaison. I see no community. There are no local support groups. I mean, folks can reach out to their case managers, but like I said, the case managers 9 times out of 10 are in training and have to go up their ladder of administration to get the answers. And it's a constant struggle. And I can only imagine for folks that don't have the support system that I'm blessed enough to have, I can see where this can affect somebody negatively very quickly and lead to other things such as, mental health issues, addiction issues, which is a huge problem in my demographic. I have no idea even how many people are suffering with this diagnosis who also have other things going on that they all kind of tie in together.
Okay, thank you. Thank you for that.
Mm-hmm.
Any other questions? Councilman Miller?
I have a question to Zoe. If you could tell me what the geographic footprint is that's covered by this council.
Sure, I can have Zach also speak a little bit more to this board too, if that's helpful. Zach, if you want to go up. I know there's Ashtabula, Cuyahoga County, Lorain County.
Yeah, so this is
Excuse me, can you state your name for the record, please?
Yes, I can.
Thank you.
Zach LeVar, I'm a Deputy Director of our Population Health Department at the Board of Health. Good morning to everybody. The geographic footprint of our Ryan White program, obviously Cuyahoga County, but then we extend west to Lorain and Medina County, and then we extend east to Lake Geauga and Ashtabula County. Just in terms of prevalence in those communities, obviously the brunt of the HIV virus is in Cuyahoga County, with about 5,100 people that are impacted by HIV. And then in the other 5 counties combined, there's roughly 1,000 people living with HIV.
And is the trend in the number of people affected up, down, or level?
It is still going up, but we have seen over the last couple of years that it is starting to slow down slightly, and that can probably be attributed to an increased level of funding from the federal level. If any of the council members are familiar with the Ending the Epidemic program, this was something that was put into the State of the Union by former President Trump. He put out that he wanted to end the HIV epidemic by 2030. So with that came a slew of funding nationwide. Cuyahoga County, with our prevalence and incidence rates with HIV, were a recipient of that fund. So the last couple of years, we've had additional funding to put out into the community, roll out innovative projects, and hopefully to get close, if not complete that goal of ending the epidemic by 2030.
Thank you very much. Very helpful responses.
Okay. There are no further questions. We won't hold you. I did want to say, Miss Elizabeth, that courage is often found in the quiet moments with no audience. And I want to thank you for sharing your story and offering yourself in service to this very important issue. So we look forward to moving you forward in this process, and congratulations.
Thank you so much. I appreciate the opportunity.
All right. Thank you.
Thank you.
Thank you.
Next, Councilwoman Zoe Taskis on behalf of the County Executive and pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the appointment of Anthony Thomas to the Cuyahoga Regional HIV Health Services Planning Council to a 3-year term that starts on August 1st, 2023 and will end July 31st, 2026. And he'll be joining us on Zoom as well.
Thank you.
Good morning. Can everybody hear me okay?
We can hear you. Good morning.
Good morning. First off, I want to say thanks to the HIV Planning Council for the nomination, and thank you all for your time. So really what I just wanted to just say is, my name is Anthony Thomas. I graduated from Case Western Reserve Mandel School of Applied Social Sciences. I graduated with a master's in science and social administration with a focus on substance abuse and recovery. Currently, my role within Cuyahoga County is the team coordinator, which is the second manager in charge for our Medicaid Neighborhood Family Service Center. So what our primary focus is Medicaid. So with our focus being on Medicaid, we provide coverage in terms of eligibility and get access to care for our constituents in Cuyahoga County. By me joining this planning council or volunteering my time over the last year with the planning council, not only have I learned a lot with dealing with the disease of HIV, but it just kind of opens your eyes to a population, that we don't talk about a lot. But when you look at the data, there's been a rise in not only Cuyahoga County, but in the state of Ohio, especially dealing with African-American males. So, I think that HIV and substance abuse go hand in hand. I believe that my expertise in both of those categories and my continued growth and gaining knowledge with HIV, I think I can be an asset to the HIV Planning Council as well as our community.
Thank you. That is impressive. Do we have any questions from my colleagues? Can you talk a little bit more about your experience? Obviously, you mentioned Medicaid is your expertise. Talk about your vision and how that's going to serve this committee.
Well, currently my role with the Planning Council is I'm the Medicaid. I give the Medicaid updates at the Planning Council executive meetings. So what that entails of is getting in front of being able to touch the other members of the county, of the council, providing any updates that the state wants us to deliver, whether it's especially with the pandemic just ending, any updates pertaining to that, any changes in coverages, prescription, pharmacies, transitions and things like that, things that don't really get out to the community. I provide that, to the Planning Council. So I think that that's something, that will be needed continuously.
So would you say you would be comfortable with making recommendations around policy?
Absolutely. Because I work with the Medicaid policy frequently, I'm comfortable with interpreting policy as well as making recommendations, in the best interest of the community.
Okay. Well, that's pretty straightforward, and I don't see any other questions from my colleagues this morning. So, Mr. Thomas, I want to thank you for your service. We look forward to you moving forward in the process. And again, thank you for stepping up. Appreciate it.
All right.
Thank you.
Thank you, Madam Chair. Next, Zoe Taskis on behalf of the County Executive, pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the appointment of Daytona Harris to the Cuyahoga Regional HIV Health Services Planning Council to a 3-year term that starts on August 1st, 2023 and will end July 31st, 2026.
All right, Ms. Harris. Good morning. State your name for the record.
Yes, it's Daytona Harris. Do I need to spell anything? Okay. All right. I am prepared. All right. So I am Daytona Harris. I work currently at the Neighborhood Family Practice, and I've been there for almost 3 years, but I've been a social worker for about over a decade now. I graduated from Baldwin-Wallace with my undergrad in psychology and criminal justice, and then I also graduated from Case Western with my master's in social administration. I have worked in a variety of settings, including courts, children's services, and foster care. I started off at NFP as a medical case manager and was recently promoted to the Ryan White program due to my passion. Well, I was promoted to the Ryan White program coordinator due to my passion and dedication to the program. During my time at NFP, I have been motivated to make certain that our Ryan White department is being effective in providing Ryan White services to our patients we serve. Our department's goals is to provide quality and comprehensive service and to address any barriers to care that a patient may have. Additionally, we aim to prevent HIV with our PrEP services and our new Ending the HIV Epidemic grant. This is my first time working in the Ryan White world, and it has been full of challenges and growth. Challenges including learning in the field I never worked with and trying to make it into something bigger and better for our patients that we work with. Growth being a wealth of knowledge that I've obtained here and for where I see my career taking me as well. I have learned so much during my time at NFP and while attending the council meetings for over a year now with the Planning Council. I sit on the quality improvement and the prevention committees. I have been blessed to have this opportunity to interact and learn from our patients living with HIV. I feel that all of my experience and passion has qualified me to serve on this board. I have been an advocate for all of my clients for as long as I can remember. And as a member of the Planning Council, I can continue to be an advocate for our patients. Becoming a part of the Planning Council will allow me the opportunity to further educate myself, which is something I always strive to do, as well as make myself a better person. While on this board, I hope to accomplish positive and meaningful change in the lives of the patients living with HIV and to work even harder to end the HIV epidemic. I want to get out in the community and make an impact, even if it's just to change the life of one person. It's a step in the right direction. With one of the things I've learned working with Ryan White program in the HIV world is HIV is somewhat the least of patients' worries. It's the resources that they are lacking and the assistance and the support. And like Elizabeth had mentioned, case managers who, come and go quite often. And so being on this board will allow me to get and obtain further resources that I can give to my clients to help them and make it easier for them in any way that I can think of. And that's it.
Okay, thank you. Any questions? Councilman Conwell?
Yes, through the chair to Ms. Harris, have you ever thought about, I hear your passion in your voice, and you're still young and can relate to college students. Have you thought about going and speaking at maybe the classroom settings for those that are going into social work and things like that, letting them know, what's needed? I mean, so many fields are kind of dying because, either not enough money or, which is probably the number one.
No, I have not actually, and that is a wonderful idea. Part of the issue with case managers, and especially in social work, is that we aren't paid enough for what we do and all the things we do. Yeah. I mean, that's just the gist of it. And a lot of our younger generation now have figured out it's better to go into a trade or something like that. But in order to make a difference, and if you have that passion, yes, I think it would be a great idea to go and speak. And since I went to Case, I can always reach out to them and,
I'm
see
sure
if I can
they'll-
do it. Yeah.
I'm sure they'll invite you back. And you know, we're facing a lot in our health and human service agencies ourselves and a myriad of departments. And so we're actually having to look at, you know, because the funding is so low for social work and anything that directly relates to a human being is always the lowest paid, but looking at part-time. So maybe going on to the campuses and saying, you know, hey, I get it that you might want to try these other fields, but we still, as human beings, need to care about, you know, and look at part-time.
Yeah.
So that passion. So you're still getting your money, but you're also, you know, helping and doing kind of what you love.
Exactly. No, I 100% agree. One of the things I always, when I'm with my patients, I always say, I can't promise you that I'm going to fix everything or that I can do everything, but I can promise you that I'm going to try and I'm going to help you through whatever it is you're going through. So if that's the least I can do to help you out, then that's what we're going to do. And I will say I have, in my short span in 10 years of social work, I have noticed the quality of social workers isn't that great these days. And working in children's services, working at the courts, I've seen it all. And if you have the passion and dedication, you can succeed in this field. You just have to want it and put in that effort.
I think if you get, you know, you go down that avenue and you reinvigorate a communication or a connection with the schools and going into those classrooms and them hearing it and maybe setting up some tours or something. Maybe, just possibly. I mean, we got to do everything that we can. And then my last question to you was, are the patients adults only at the neighborhood family practice?
Yes, correct. We serve all patients, but for our Ryan White program, our provider, she mostly handles adults over 21.
Okay, I didn't know if children get HIV.
They do, but
Okay,
we
'cause I
just
know
don't
they
offer, well, not that we don't offer it, we just don't have any patients under the age of 21 or 18 at this time.
Okay. Thank you, Madam Chair.
Okay, you're welcome. Sweeney, Councilman.
Thank you, Madam Chairwoman. I'm just want to say thank you. You're volunteering. This isn't the most prestigious or sexy board to be on, but it's important,
It is.
and it's been long overshadowed with the negative connotation. And through the chair, I had the privilege of going to the 10-year anniversary of the AIDS Task Force, joining the American Healthcare, or AIDS Healthcare Foundation. And this is, I've been around 60 years. I never knew the AIDS Task Force headquarters was right next to the Board of Election. And they have a full pharmacy. It is absolutely extraordinary resource. And I'm just curious on, you're brand new, but the next person that's coming up, interacting with them's got to be uplifting. And they had their national convention here. And I got to give my little resolution, and I felt so embraced. And
Yeah, no, all the agencies provide wonderful, wonderful work. And like I said in my little presentation, I mean, I've only been in this field for about 3 years. I knew nothing about HIV, but one of the things I love is learning something I don't know, and educating, you know. So what I've learned, I've been able to educate to my family who is unaware, you know, don't really know how the HIV but like how HIV works in a sense and things like that. So being able to learn about all the resources and the great work that they do is just amazing. So I agree.
And through the chair, just part of my little comments was HIV is a disease. And it's way too common to be connected to a group. And over time, I think it's back to being neutral, at least in regards to a disease, and not connected to a group.
Yeah.
And that's just wonderful. And I hope it just continues to progress.
And at the neighborhood family practice, that's what we kind of try to, we group it as a whole, kind of as like, this is a chronic disease, just like any other disease, but there's things out there to help you, just like a lot of these other chronic diseases. So it's nothing to be ashamed of. It's nothing, you know, this is just part of your life right now, and we're here just to try to make it a little bit easier for you.
And through the chair, a little shout out to Neighborhood Family Press.
Thanks.
Come up to Puritas, you're on 117th, now you're moving to 130th. We love you in the neighborhood.
We got to come visit DSO, Detroit Shoreway. That's where we're at. Well, I'm at.
Just saying, we're in my world.
Oh, no, I got you. I'm saying you got to come visit us over at DSO.
Guess what?
What?
I'm your county council person, so you invited me, I'm coming.
Okay, then.
Chair. Thank you.
Thank you, Councilman. No further questions. Thank you so much for your quiet strength. I feel your passion. I was thinking, Councilwoman, that later today, I think we're going to be involved in a conversation with Metro Health about their first ever minority women's health fair and symposium. Maybe that's something you might want to consider participating in. So we'll keep you in the loop. We'll keep you posted on that. I think my word for today is courage. And this quote comes to mind: courage doesn't always roar. Sometimes courage is the little voice at the end of the day that says, I'll try again tomorrow. And I think that's what you exemplify in this space. So welcome. We look forward to moving you forward in this process. And thank you again for your service.
No, thank you, guys. You guys have a good one.
You too.
Thank you, Madam Chair. So finally, Zoe Toscas on behalf of the County Executive and pursuant to Section 604 of the Cuyahoga County Charter, I'm here to recommend the reappointment of Leander Lavette to the Cuyahoga Regional HIV Health Services Planning Council to a 3-year term that starts October 28th, 2023 and will end October 27th, 2026.
18 years. State your name for the record.
Good morning, everyone.
Excuse me, Mr. Levitt, can you step closer to the microphone, please?
Good morning, everyone. Is that good enough?
Yes.
My name is Leander Lovett. I'm 60-year-old black male living with. I'm an Army veteran, and I'd just like to thank y'all for having me, on this council. First of all, too, I like to say, excuse me for the attire, because we was displaced and stuff like that, and our stuff is like scattered all over, But anyway, after hearing all these accolades from Tony and young lady here, I don't even know if I'm in the right room. But anyway,
you are. You definitely are.
But anyway, for the years that I've been on the Planning Council, it's been a joy. I learned a lot. I never really knew it was so many components for the civilians to deal with, because by me being a veteran, I get excellent care and treatment. Another thing is, I know it helped me look and see how many of the other people don't have the resources or don't even know about the resources. Some people, they find out about the resources, they just don't care, and it ain't nothing you can do, to try to get them to see that just because you living with that, you just have to go down this dark path. And I try to be an example every day, even dealing, when I first learned of my diagnosis, I lost it. I went down a dark path, and it dealt with drugs, alcohol, anything that was negative. I dealt with it, but it's going on 5 years now since I've been away from that stuff, and since then my life has turned around dramatically. Even though I'm living with. I'm fairly healthy, I'm able to go to the gym and stuff like that. But my thing is to be here to help the next person that may not see a way out or may not think that, you know, you can go on living and stuff like that. Because in the beginning, I thought it was a death sentence, you know. But a lady at the VA by the name of Jan Briggs, she told me she was like a mother, just so loving and caring. She said, you don't have to go down this path. She said, don't let the disease define you, you know, because she said, I know you're a good person, you're a great person, and go ahead and show everyone, you know. So her words kind of got me in, you know, my last episode where I almost checked out. So ever since then, it's been about being in something, being with my grandkids, and being the best version of myself. And far as the little accolades and stuff like that, I am a certified peer supporter. So that way, if anyone need, you know, some support, you know, I'm one of the people that they can come to. I'm a certified PrEP clinical provider, and I'm currently studying a bachelor's of science in accounting with associates of arts in business fundamentals. So, you know, I'm doing pretty good there, and I'm just trying to keep my head afloat, even though with all the distractions and mess that's around me, you know, I'm standing strong so I can show other people that, you know, it'll take a lot to break this spirit, and that's it.
Thank you. Any questions from my colleagues? Comment? Councilman?
Madam Chairwoman, quite impressive. I'm 60. You're class of 81? High school?
No, actually,
Forget it. I'll ask another question.
no, you gonna want to hear this one. You gonna want to hear this one.
I'll hear whatever you tell me. I don't want to make it tough for you, though.
You gonna hear this? No, you can never make it tough for me. I was getting ready to, I was 16 years old. I just came from the store asking some man to get me a quart of beer. I was getting ready to watch Speed Racer, and the commercial came on.
Speed Racer.
Uncle Sam won't shoot in today's Army.
No way.
I called the number. When he came and got me the next day, I'm looking at the pictures on the wall. I said, y'all go there for real? He said, yeah. I said, where I sign? And that was it. But I mean, I had to get my mother to sign for me to go in, but.
Madam Chair, thank you for busting out a Speed Racer for me. You know, I didn't think I'd get that one ever again.
Yeah, that's it.
And you put me to shame. I think I'm trying to keep myself in shape a little bit. I thought that was a 5-year deal you have with Puma because you're wearing it. You know what I mean? So I'm just saying thank you, man. Excuse me. Your story's good, and your heart is even better. So just keep up the good work, and we're very blessed to have you part of this and taking care of the folks in Cuyahoga County.
Yes.
Thank you.
Councilwoman?
Just was going to ask through the chair, you mentioned that you were, Mr. Levitt, that you were displaced. Are you one of the fire victims?
Oh, no.
Oh, okay. From
No,
East
no,
Cleveland?
Nothing against them.
All right. Well, that's a blessing. All right.
Yeah. Trust me, believe me, it is.
To share your weaknesses to make yourself vulnerable, and to make yourself vulnerable is to show your strength. So thank you so much for the hope and the optimism that you have provided to individuals living with HIV and AIDS, and thank you for your service to this council, and we look forward to your continued service. Councilman Miller, Yes.
So I just want to say how important it is to have people who have had real life experience and who have been in the trenches with HIV on a board like this, and we have both you and Elizabeth who fit that description very well, and I think we really need your wisdom, experience, and knowledge of what it's like actually going through it. So thank you very much for your willingness to serve.
Okay. All right. Thank you.
Thank you, everyone.
Ms. Toscas, any final words?
No, thank you. I think we had an awesome slate of candidates this morning, so thanks for hearing from everybody.
Okay,
And
can we go?
thank you guys for speaking.
Can we go 3 readings? Oh, she did.
Second
Okay,
reading
I'm
suspension was the request.
slow this morning. Okay, can I have a motion to move this item to the full body of council for second reading under suspension of the rules?
So moved.
So second. First by Conwell and
Is there
second
any,
by me.
is there any discussion?
Madam Chair, every year we go through this with these appointees, and I always mention my good friend John Kerry, Dr. John Kerry, who untimely passed away over 28 years ago now. And I met John through my wife, who did her master's thesis on AIDS because of her connection with John. And the loss of him was devastating. And I really appreciate your helping us out here. Thank you.
Thank you, Councilman. So it was moved by Conwell, seconded by Miller. All in favor? Aye. Okay, thank you. Is there any miscellaneous business? Hearing none, this meeting is adjourned.